Thank you, sir, for such an interesting topic. Now moving forward to our second talk, which is endocrine perspective of pituitary guidelines. And for this, I will invite my teacher and mentor, Professor Dr. Najmul Islam. He is Professor of Medicine and Consultant Endocrinologist at Aga Khan University, Karachi. Sir is also the ex-president of Pakistan Endocrine Society, Dean Convener of Endocrinology CPSP, and recipient of Lifetime Achievement Award from Pakistan Endocrine Society. Welcome, sir.
Assalamu alaikum, everybody. First of all, I would like to thank Pakistan Endocrine Society for giving me this opportunity to share my details of what I went through the development of this pituitary guidelines. I'm going to spend more time on endocrine perspective, but my subsequent expert, Professor Athar Enam, is going to spend more time on the need for developing guidelines for low middle income countries. So first of all, actually the whole idea came, we have pituitary MDTs in Aga Khan University Hospital, where endocrinologists, the neurosurgeons and the radiation oncologists meet every month. And this idea of having a separate guidelines for this part of the world, because we don't manage each and every patient in the same way as it is managed in the Western world. So that was the beginning of the whole idea. Then this idea was discussed with Professor Khurshid Khan, who was the president of the Pakistan Endocrine Society at that time. And he agreed to this, and then this mandate was given to us for the development of guidelines for the low middle income countries. A committee was constituted, which had the following members, and I was asked to chair the committee. And obviously, important people are here: Dr. Aisha Sheikh, Colonel Shahid Ahmed, Nanakram, Waqas, and Uruj Dal. Then subsequently, there were other members from the Neuro-Oncology Society, Professor Athar Enam, Professor Asif Bashir, and Ehsan Ali Khan. And then subsequently, radiation oncologist and neurosurgeon was further added. So that a comprehensive group of people who were involved in developing these guidelines. We met innumerable times, mostly virtual, and then subsequently, with a lot of hard work, the manuscripts were developed. The manuscripts were further reviewed by the national and international reviewers. The list of the reviewers, the national and international, have been listed here. And so that's how we developed these guidelines. And the objectives of this committee, which is basically, there's a lot written about the pituitary adenoma management and guidelines in the Western world, but unfortunately the low middle income perspective is missing in these guidelines. The objective of the committee was to bring this perspective of the management of guidelines in pituitary adenoma. So that was the main thing. And this is what is the front page of our guideline. And you can see the title also says, Resource Adapted Approach for Low Middle Income Countries. Okay, this is the editorial. And in the editorial, we have highlighted the same reason for developing this. And you can see that treatment strategies need to balance efficacy with cost effectiveness. For functional adenomas, the guidelines advocate using most cost-effective pharmacological agents, considering local availability of drugs and cortisol-lowering medication. The cost of treatment becomes a crucial factor in lower middle-income countries. Sometimes surgery may be more effective than expensive medications to control hormones, although often necessary surgical resection must be approached with a focus on optimizing available resources. The guidelines recommended the use of transfemoral surgery as the gold standard due to its minimally invasive nature and shorter recovery time, which are crucial in setting with limited inpatient facilities. Efforts should be made to train local surgeons in these techniques to establish regional centers for excellence to minimize the need for long-term travel. So basically, we have highlighted this in the editorial, the need and the reason for developing these guidelines. As we all know that very good guidelines are available across the globe on pituitary management of pituitary adenomas, but a local perspective has been added to customize it to the local needs. So we have 8 chapters to these guidelines. The non-functioning adenoma followed by acromegaly, all these functional adenomas, and then stereotactic surgery has also been covered, and a perioperative endocrine management of pituitary adenoma is as a separate chapter. So 8 chapters in total. And then I'm just going to share some of the algorithms. I don't know whether you can see it from the back or not. This is about a suspected prolactinoma, and then the algorithm showing in different directions. First, to establish the hyperprolactinemia cause, whether it is drug-induced or some other reasons, and then subsequently working it up for adenoma, pituitary adenoma, that is prolactinoma here. And then again, once the imaging has been done, micro, macro, and then there comes the treatment algorithm by which medications to adopt and where to go for surgery. So these are the about that. And then we also covered for pregnancy in prolactinoma. So microprolactinoma, macroprolactinoma, and different reasons when to stop it and when to reconsider starting it. So all that has been dealt in detail in this guideline, and the algorithm is just showing what it is. The same applies for Cushing syndrome. The step 1 is the discriminatory clinical features, then the workup, and then followed by workup is the cause of the Cushing syndrome, and then subsequently the management. So, and we have also touched on the TSHoma, where this is a rare tumor, but again, something that is worth for a comprehensive guidelines to have that aspect as well. And with this, I would like to thank everybody for listening to me. And then my subsequent speaker, Dr. Athar Inam, is going to give his perspective on the management of, on the development of these guidelines, and particularly the need for developing guidelines separate for low middle income countries. So that's what I have to say. Thank you very much.